Hello, I'm Dr. Bhuvaneshwari, consultant neurologist. Stroke is one of the major causes of disability all around the world. According to the WHO, about 15 million people get stroke every year. Now, stroke, as you know, is treatable. If you come within the golden period, that is the window period, which is 4.5 hours from the onset of stroke, early intervention with medication to reduce and the effect of stroke can actually make a huge difference to the patient. Stroke is actually caused by two mechanisms. One is a blood clot and the other is bleed. If it is a blood clot, which is the major cause of stroke in most patients, you can actually treat them with a clot-busting medication. And also sometimes in select patients use techniques to remove the clot. Now this is treatment of acute stroke because these interventions make a huge difference to the patient, one by reducing the disability, and very rarely we do come across patients who have complete recovery. But stroke is all about how do you cope with the disability that occurs with stroke, where do you take it from there? This is acute treatment. Once the acute treatment is over in the hospital, what do you do? See, rehabilitation is a very, very important intervention in the management of stroke because stroke occurs within few seconds. But the disability that you have with stroke, which can be mild, moderate or severe, we have various degrees to assess the disability and various scales like the Rankin scale to know what is the level of disability. Whatever is the level of disability, tailored to the patient's requirement, we try and fix up a rehabilitation program. The rehabilitation starts in the hospital and it continues either at home or in a rehab center, which is completely focused, which gives you comprehensive interventions such as physiotherapy, speech therapy if your speech is affected, swallowing therapy, and even occupational therapy, because it is all about getting the patient to do his everyday duty or work on his own without the help of others. So stroke rehabilitation is very, very important, and it is important that we start making plans for rehabilitation once the patient is clinically stable from after stroke. And when a rehab program starts, it is a team of people who make decisions for the patient. Starts off with doctors, speech therapist, physiotherapist, occupational therapist. We sometimes even have to involve psychologists and psychiatrists if the emotional requirement is to be filled in. So rehab is very important for the long-term management of stroke, and we need to look into rehab centers which give you this focused rehabilitation for patients with stroke and to bring them back to their normal life, to get them, integrate them back in the society after the stroke.